Hello, my name is Daniel Rasmussen, and I am the Executive Director here at Pinnacle Acupuncture and Associates. And I am going to talk to you about chronic pain. Anytime there's pain in the body, you have sensory nerves which are firing, and you may or may not have structural problem causing the pain or the sensory dysfunction. In most cases, chronic pain actually has no structural cause at all. The problem with most doctors who diagnose structural problems causing pain is that they are not well versed in the field of neurology. Their immediate assumption is that if you have pain, there must be a structural reason for the pain. In other words, there must be some form of structure, either bone, soft tissue, disc, or some object actually pushing on the sensory nerve, causing it to fire continuously. This assumption is not true. Actually, in most cases, chronic pain has no structural reasons for the pain at all. Yes, your back can look like a corkscrew, but the neural impingement that your doctor is telling you about is assumed from a radiology report. However, an MRI or X-ray cannot actually see the nerve. Consequently, the medical profession is assuming, based on their idealized knowledge of anatomy, that your pain has to have a structural cause. However, in most cases, the sensory nerves are swollen and firing on their own with nothing pushing on them. In order for the brain to register pain, there has to be two types of neural signals hitting the brain at about the same time. The first signal is from the sensory nerve, or nerves themselves. The second is from the proprioceptive nerves, which are also firing right next to the sensory nerves. The proprioceptive nerves actually tell the brain where the pain is emanating from. If everything is working properly, the brain will release a torrent of natural painkillers called enkephalins. These chemicals are the body's natural painkillers, and they plug up the pain receptor sites in the brain, all along the spine and in the capillary beds where you feel the pain. They stop the chronic pain and allow the body to return to a normal function, somewhat. Obviously, with those patients who suffer from chronic pain and discomfort, this mechanism is no longer working. There are many reasons for the body's natural pain-relieving mechanism to stop working. However, the number one cause appears to be a chronic signal strength problem in the proprioceptive neural tissue. This is key. If the neural threshold level, or signal strength, is too low, the brain will not know exactly where to release the enkephalins, and thus the pain continues. Acupuncture will raise the signal strength on the proprioceptive pathway, and the result is a sudden and dramatic relief from pain. For this reason, we can treat an incredibly wide variety of pain problems, such as back pain, bursitis and tendinitis, Bell's palsy during the first 3 to 6 months, headaches and migraines, hemorrhoids, intercostal neuralgia, Meniere's disease, neck pain, peripheral neuropathy, sciatica, frozen shoulder or shoulder pain, sports injuries, tennis elbow, carpal tunnel syndrome, stroke and paralysis, TMJ, trigeminal neuralgia, the list goes on. This acupuncture technique that we use does have its own problems when a patient's pain is caused by a structural problem. In those cases, there is an actual tissue pushing directly on the sensory nerve or group of nerves. Jumping the signal strength on the proprioceptive nerve pathway alone will not solve this type of problem. Patients usually of this case will need more invasive procedures down the road, such as surgery. However, acupuncture may help put the surgery off to a later date. If you would like to have us evaluate your condition, your pain condition, and see if you are a good candidate for our methods that we use here in our very unique clinic, we use a very unique protocol for acupuncture that usually results in immediate and lasting results with a series of treatments, with corrective care usually resulting in 85% of our cases generally. If you would like to get your consultation and health history evaluation, please call the number below the video screen now to get more information. Why wait any longer? We look forward to seeing you in the clinic.